Breast augmentation using fat grafting is a way to use a woman's own tissues in an effort to augment the breast. Historically, we've used implants for years and years. It's been a controversial subject over the last decade or so as more and more people have used fat transfer or fat grafting, where liposuction is used to take fat from one part of the body and transfer it to the breast area. Fat grafting for breast augmentation allows us to essentially achieve an augmented breast using a woman's own fatty tissue from areas that she would like to get rid of anyway. So it's grown in popularity. There's been a process through which the science of the procedure has been necessary to understand the safety of the procedure, especially as it relates to monitoring, because as fat is injected into the breast tissue, it can change or alter a woman's mammogram. And this is important in the consultation process, that as we discuss it with women, that they understand that these changes can occur and exactly what that might mean in terms of long-term monitoring. But certainly fat transfer or fat grafting for breast augmentation is a new and exciting area of plastic surgery where science has now kind of culminated in a new procedure that's changing what we're doing to augment the breast. So the best candidates for breast augmentation using fat grafting, instead of using an implant, are women who are looking for a more subtle change in the breast. These are going to be women who might be looking at a half cup size change or to a cup size change in their breast. It's important to understand that with fat transfer or fat grafting to the breast, unlike when an implant is used, that often one or more procedures can be necessary to get to the exact size. Because some of the fat that's transferred stays permanently and some of the fat is simply dissolved and reabsorbed into the body. And because you don't really know in each patient until after the procedure is performed what percentage of the fat that's transferred is going to stay, it's important to view this as a procedure that allows a more subtle change in augmentation of the breast. It's particularly helpful for women who are looking for that half cup size to cup size change, but specifically maybe a little bit more fullness in a particular area of the breast, like the upper pole of the breast, where volume is often lost in mothers who have breastfed. So fat transfer in particular seems to give women a more modest change, and so it's best for those women who are looking for that half to 1 cup size increase. How many surgeries are involved is different from patient to patient. Certainly there are patients who one surgery gets them where they're going. There are other patients who will lose some of that fat as the body simply resorbs it. This is a natural, normal process. It's not a complication per se of the procedure. But in those patients who may lose a little bit more of the transferred fat, they may want to have a second procedure. So additional procedures can be necessary, and this is one of the real distinguishing differences between an implant-based breast augmentation or breast enhancement and the use of fat, is that sometimes additional procedures are necessary.